Now, this week it was all about Lamar Odom, a great athlete, 6'10", young in his 30s, won 2 NBA championship, someone who is well respected in the field of sports. And apparently they found him taking a lot of herbals, Viagra. And we got so many calls and questions about, are these herbal Viagra safe? What's in it? Should I be taking them? And the big question is, why should someone take herbal Viagras and what's the difference? So I think a lot of this has to do with the fact that people don't want to go to the doctors. They don't want the whole stigma of like erectile dysfunction. They also, find some of these herbal Viagras safer because it has the word herbal, and we'll talk a little bit about this. And also the price of this. Right now in this country, the price of one pill of Viagra or Cialis could be somewhere between $25 to $40, whereas some of these herbal Viagras you can buy for $3, $4 in gas stations, over the counter, and so many of these stores, and you don't need any prescriptions. But this is the problem. When you hear the word natural, organic, herbal, all of a sudden you think, well, it's got to be safe because it's herbal. And the big news is that it's not true. FDA is not regulating these herbal Viagras. You don't know what's in it. It's probably not safe. And we don't really know the ingredients. There has been a lot of cases where they have found paint. Yes, that's right, paint, rat poison, sheetrocks. And also they have found the real component, sildenafil, which is a real Viagra, and the tadalafil, which is a Cialis, in these pills. Why is that important? If you think you're taking some herbals, but in reality it has Viagra in it, and you're mixing it with nitrous, you're mixing it with alcohol, you're mixing it with cocaine in this particular case, you're going to lower your blood pressure, you put your heart in danger, you may get heart attacks. And of course, after like 3-4 days, apparently he took like about 10 of these pills, and that cumulative factor and mixing it with alcohol is devastating. And we saw that he was unconscious, and now there are some signs of good news that he may be responding. They got the blood test, and certainly there's like some cocaine involved, and there's more to this story that we're going to find out. But apparently there are some signs of kidney failure and possible liver failure, etc. But the bottom line is, because it's not being regulated and FDA is not on it, you want to be careful about this. Well, how does Viagra, Cialis, and Levitra work? These are what we call vasodilators. And in men who have erectile dysfunction, a lot of causes of this is diabetes, blood pressure, and the vessels in the penile tissue can get obstructed or they get plaques. And the sensation may go away in diabetic patients, and they may have erectile dysfunction. What these medications are supposed to do is to bring the blood flow to the muscle of the penile tissue and give you the erection. And the herbal medication are supposed to simulate and be the same way, except, like I said, they may have 10 times more of the amount of Viagra, and they can put a lot of pressure in you. Someone like him, who is in his 30s, the question is, why is he taking something like this? Is this a performance enhancement? Is it to prevent anxiety performance? He's going to this lounge, some Playboy lounge that he was there, and he's with multiple women, etc. Do you need to take any of these or not? Typically, if there is erectile dysfunction in a young man, it's probably the early sign of heart disease and heart attack. When we see someone in their 35, 40-year-old come in, a lot of it is psychological. 80% of this is all mental and psychological performance anxiety, but about 20% of it could be real. And in those patients, the first sign of heart disease and heart attack in young men is sexual dysfunction. And that's why you want to get them to cardiologists, and giving them a prescription for Viagra or Cialis is not the case. I highly doubt that in this case, he was trying to save money. He has all the money in the world. And, I think he just didn't want to go to the doctor, or he just wanted to have this depression, which is the underlying disease in him, also can play a role. So you got to be careful.